focus right now is China, of course, experiencing a massive surge in coronavirus cases after it eased its COVID-19 restrictions earlier this month, following a wave of protests where residents were fed up with the stringent lockdowns, mass testing, and quarantines. Now, an epidemiologist and health economist based in the US said that more than 60% of China and 10% of Earth's population are likely to be infected over the next 90 days, with deaths likely in millions. Now, hospitals in Beijing are overburdened with coronavirus cases after the sudden surge. In fact, workers at funeral homes and crematoriums are reportedly working extra hours to deal with the rise in COVID deaths. For more on this, I'm actually joined in by a guest who's joining us on the broadcast. In fact, I have Dr. Monish Tourangbam joining us on the broadcast. Dr. Monish, appreciate you taking the time out and talking to us on Mirror Now. My first question, of course, to you would be, China, of course, went ahead after those protests and eased those restrictions. But what we're seeing right now is definitely a cause of concern.
Yeah, thank you, first of all. And I think it's an important question to ponder upon at this point of time, that after the restrictions were taken off, and what kind of a policy China has been adopting as far as combating the COVID-19 crisis is concerned. And I think we don't need to tell here anymore that first of all, it started in China. But I think the point here to consider is the case of China's what they call as a zero COVID policy, or what they also call as a dynamic zero COVID policy, responding to the crisis as it evolves. But I think what was seen as a success point for China in terms of controlling the spread of the virus is also turning out on its head. It's also turning out to be the cause of concern and the cause of a failure in some sense, because the difference in terms of looking at how to combat the virus, while other countries in the world have been looking at penetrating through vaccines and also boosting immunity across the population. In China, in trying to control the COVID surge dramatically, and in trying to show to the world in some sense that we are better in terms of controlling this COVID crisis, and then we can really have a zero COVID policy. I think the Chinese government has somehow overlooked the point and the efficacy of widespread vaccination, and also trying to boost immunity. And as a result, what is being seen is that in trying to make sure that there's a complete control on the virus through drastic measures and others, what experts are telling is also that there is a large gap in terms of vaccinating, especially the elderly people in China, the 80+ population in China. So I think what we are seeing is something which comes out of China's zero COVID policy itself, that in trying to control drastically, in trying to make sure that China could show to the world that it could have a zero COVID statistics, what it has done in the process is that it's ignored penetration of vaccines, it's ignored looking at the efficacy of vaccination, it's ignored looking at immunity boosting, and as a result, a large population of China now stands exposed to new variants, and it gets exposed because of the fact that much of the Chinese population has not been exposed to these new variants, and hence they might be much more
Dr. Monish, sorry for interjecting you there, but the fact that you're, of course, raising these points, in a way, of course, China wanted to show that they had things under control, which is why at one point they decided to ease those restrictions, which is kind of definitely backlash now. But what should be the cause of concern for health experts now? Because we even talk about the numbers, it says that currently 60% of China and 10% of Earth's population to be infected in the next 90 days, which means the big question, of course, for everybody will now be, will the world again see, a stage of lockdown? Because one has to remember, you also mentioned earlier that at the end of the day, this is not a post-pandemic era that we're still living in.
Yeah, sure. I think that's a difference in the strategy that I was talking about earlier also. while in other countries, including in our own country, there seems to be an outlook and a policy that we are going to live with the virus for some time, and the strategy to fight the virus should be accordingly designed in a way where we do not say that we are already in a post-pandemic world. We do not say that we could completely control this virus and somehow put an end to it completely. So I think what China is facing right now is a result of that kind of a strategy, that somehow you could have a complete control of the virus and you could sort of move to a new normal. I think the new normal is that we are going to live with this virus for some time. We are still in the pandemic era. We still need to keep vigilant so that a mass lockdown that we had seen in earlier times, does not come again. I think what is important is also to note the kind of protest that you are talking about is also related to the fact that such lockdowns and such complete lockdowns do have a drastic economic impact in terms of what you are seeing in some of the Chinese provinces, which could definitely impact the global supply chains. And even as we talk about shifting of global supply chains and diversification of global supply chains, we need to remember that the Chinese economic growth has impacted the world in the last 2 decades. And so anything that happens in China is going to have a massive impact on global economy and global supply chains. And it's not going to be easy to diversify and shift the global supply chains in such a short period of time. So I think China needs to understand that the new normal is to live with the virus in some sense and strategize accordingly, rather than having a one size fit all strategy of thinking that this virus could be completely controlled. So I think we need to keep visit. The world, every country in the world needs to keep a vigil. As you said, the predictions are quite dim. And because of the dim predictions as far as health concerns and lockdowns are concerned, the predictions of economic outlook in the world could be quite dim as well.
All right, Dr. Monish, appreciate you joining us on the broadcast here and giving us your viewpoints, but we leave it at that for the moment. Dr. Monish, Senior Assistant Professor at Amity Institute of International Studies, joining us there and giving us his viewpoint. But continue to track this particular story on Mirror Now. In